29, I'm going to be applying a modified Robert Jones bandage to the forelimb of a canine patient. So our tray of supplies includes our tongue depressor to make our stirrups, our vet wrap, our padding, our 1-inch tape, and our, our 1-inch tape and our 2-inch gauze, and our bandage scissors here. So the first thing we're going to do is make our stirrups. Well, actually the first thing is to restrain the patient, and Daniel's got her in lateral recumbency. And then we want to go ahead and do our stirrups. You want to make sure that it extends 5 inches below the foot. And these go on the medial and lateral aspects of the paw. Then we're going to put our other one on the medial aspect. I know, sweetie. I know. Alright. So after that, we're going to do our cast padding, or our padding here. We're going to stop right below the elbow. So we're going to make sure that that layer isn't too tight, and we're going to go ahead and do another layer. You're doing so good. You want to make sure this joint here is nice and straight. Alright, so that's all we need to do there. So I'm just going to cut this. The next thing we're going to do is our gauze. Starting distal with this too, and before we do that, we just want to also check and make sure this isn't too tight and that I'm not feeling any heat or swelling there. And this also should not be very tight. And after that, we're going to undo our stirrups here, or make our stirrups. I know. And then we want to make sure that those two toes are visible. All right. Now we're just going to loosen up our vet wrap a little bit. And this should not be very tight either. I'm just going to cut this with my bandage scissors. All right, and that completes our modified Robert Jones bandage. Also, you want to check these two toes here for any heat or swelling. Another thing for the owner to look at is any swelling or heat at home or any foul odor, because that can mean that there is an infection, especially if there were any wounds before we began this bandage. We would want to address those first, and if we had to put any ointment or anything on those wounds, we would do that before we even began the bandage. But we always want to let the owners know that if there is any swelling here on the toes or heat or any kind of smell, that could be an issue with the bandage, and we want to take the bandage off and reevaluate.